Hi, I'm Crystal Nelson, an ergonomist with Alta Ergo. Today I'll be talking to you about ergonomics as it relates to dental workers. This is an important field to consider because of the limited amount of opportunities that a dental worker has to move from point A to point B. So let's go over a few things to consider. Number one is your own personal space. So always make sure that you're in a good, neutral, upright posture. So shoulders should be down and back. Your spine should be in a neutral position and have your hips in a neutral position as well. So they allow you to maintain the most support throughout your workday. Once you have to lean forward or side to side, then that puts additional strain on your body, which we definitely want to eliminate. Generally speaking, the majority of the issues that we experience throughout our workday are because of our own personal habits. So if you can get into the habit of maintaining a neutral position, the better you will feel at the end of your workday. Be mindful of your neck too, where imagine that your chin can be tucked back slightly as well, and that will help to further promote that neutral spine position. When you're picking a dental chair, you want to make sure that you have good back support. This will help support you as you're slightly leaning forward to reach your patient. Also consider your seat pan. It should slightly tilt downward if you are leaning forward. So imagine that your seat doesn't tilt downward and it's parallel with the floor. Then what happens is when you lean forward, that decreases your hip angle. So by tilting your seat downward, when you lean forward, your hip angle remains open at 90 to 100 degrees while reaching your patient for the tasks that you need to do with them. If there are arm supports available, definitely use them. They may get kind of tricky to get used to, and sometimes they may get in your way. But when you can use an armrest, definitely use that to your advantage because that takes away some of the weight that's distributed throughout your lumbar spine and your hips, and then it can be distributed out to your arms instead. Another thing to consider is wearing dental loops. So these are the glasses that magnify the image that you're looking at, and even better are ergo loops. So with ergo loops, they magnify the image that you're looking at and they angle your vision downward. So you can be looking forward or have your head forward, and then the glasses angle your vision downward so you can see what is below your line of sight to help you remain in this neutral position. While you're fully supported with your chair and your head is in a neutral position, then communicate more with your patient. So cue them to turn their head to look towards you or look up, look down, maybe even scooting closer to you while they're lying in the chair. So communicating with your patient is ideal. I know we want to keep our patients comfortable, and most of us have been in a dental chair. It's just a short part of our day. But as a dental worker, we're in this position for most of our day. So if we can change the position of the patient to our advantage, that is the best case scenario. As far as hand tools go, keep them close by. You want to eliminate how far you're reaching for your commonly used tools. So tools should be placed within your comfort zone. So your comfort zone is your arms relaxed down by your sides with your elbows at 90 to 100 degrees and your shoulders approximately at 20 degrees. So this is the area that you should be commonly working in. So adjusting your patient and your tools to meet those needs is the most ideal situation. When you're using hand tools, find a handle that's a little bit larger. Once you have to hold on to a handle that's smaller or you're having to create a smaller pinch, it puts more force and pressure on your digits, on your hands and fingers. So if you can open up that grasp to a larger grasp, and even one that's coated in maybe silicone or another soft surface that can be easily cleaned, that will help to accommodate a more natural hand position where it eliminates more force and pressure applied to your hand. And with that, just be sure not to hold on to instruments too tightly. So just gently hold on to them just enough where you can get the job done, but reduce additional force that's needed to hold on to that tool. And then the final three things I have for you are items to consider that don't include your patient directly, and maybe some things you can do outside of this one position here. Also consider your footwear. Our feet are supporting a large majority of our body weight, so you want to make sure that you have good, comfortable shoes to help support the force that is distributed down to your feet. Also make sure you're moving as much as possible throughout your workday. So consider some of the job tasks that you're completing with your patient. Can some of those maybe be completed in standing instead of always sitting? Or maybe you have a patient with vertigo, for example, that needs to be a little bit more upright. So scheduling that patient where you can stand, or getting a patient chair that raises to a high enough level so you can complete tasks in a standing position. Or maybe if you're typing and doing computer work and documentation after the patient leaves, is that something that could be completed in standing? If that's the case, then you're sitting for a percentage of your workday, standing for a smaller percentage of your workday, and changing these positions every hour. The goal for ergonomics is to always be changing and to always be in a different position. Also check your position that you're working on your patient with. Ideally, it'd be best if you work with the patient from their crown point versus off to the side. That way everything is right in front of you versus always reaching and looking over to the side. And then in addition to moving about as often as you can throughout your workday, always incorporate a stretch, at least one stretch in between your patients. Ideally, if you could complete 3 stretches, that would be even better, but one is better than none. So complete those stretches in between your patients to help improve your circulation, get some different muscles working, and even relaxing some muscles as well. If you have more questions about ergonomics as they relate to dental workers, or maybe you're in a whole nother industry and you have ergonomic questions as well, that's completely fine. Always feel free to reach out to us via our website or like and subscribe to our YouTube channel, and you'll see more ergonomic tips and tricks coming your way. Thanks for joining me.